Okay, continuing with hematopoietic growth factors. So this heading you can add in the types of in the types of immunotherapy. I have not added. Okay, hematopoietic growth factors are used to support cancer patients throughout the treatment of the disease. So these are the growth factors which will increase the number of blood cells. For example, when a patient is undergoing chemotherapy, his chemotherapy can affect even the normal cells along with the cancer cells. So depletion of bone marrow suppression is one of the major side effect of chemotherapy we have studied. So when bone marrow suppression is there, almost all the needed blood cells will be, and the number will be reduced. So these hematopoietic growth factors, in that the main category, colony stimulating factors, will help to improve the number of these cells in the hematological system. So CSF will stimulate the production, the maturation, the regulation and activation of cells of the hematologic system. So there are four types: granulocyte macrophage colony stimulating factor, GM-CSF. So these all drugs are given in our hospital regularly. So first one is granulocyte macrophage colony stimulating factor, GM-CSF, sergramostim. It is best indicated after bone marrow transplantation. So after bone marrow transplantation, if we are giving this thing, it will increase the number of blood cells. But there are side effects: nausea, vomiting, diarrhea, fever, chills, myalgia, headache, as well as fatigue. And next one is GCSF, granulocyte colony stimulating factor, filgrastim or neopogen. This is commonly used in our hospital. Pegfilgrastim, other type. Best indicated during chemotherapy-induced neutropenia. Side effects are bone pain, nausea, as well as vomiting. These are drugs mainly given through intradermal route. Then erythropoietin. Other growth factor is erythropoietin. The drug name is epoetin alpha, epogen, or darbepoetin alpha. These drugs will increase the erythropoiesis. Best indicated when anemia related to chemotherapy as well as anemia related to cancer. The side effects are hypertension, thrombosis, and headache. And last one is interleukin 2, platelet growth factor. Interleukin 2 we have already studied in non-specific immunotherapies. So it is also having this action. Oprelvecin. It is termed as oprelvecin. Best indicated when thrombocytopenia related to chemotherapy. It is a platelet growth factor. But there are side effects like fluid retention, peripheral edema, dyspnea, tachycardia, nausea, and mouth sores. So, colony stimulating factors or hematopoietic growth factors are granulocyte macrophage colony stimulating factor, GM-CSF, granulocyte colony stimulating factor, GCSF, erythropoietin, interleukin 2, platelet growth factor. So from the name itself, targeted therapy, the therapy will target specified cell. Here it will act against the cancer cell. It will not act against the normal cells. So there are different types. Targeted therapies include epidermal growth factor receptor tyrosine kinase inhibitor, BCR-ABL tyrosine kinase inhibitors, monoclonal antibodies. These are also targeted therapy we have already covered. Angiogenesis inhibitors, proteasome inhibitors. 5 classification. First one, epidermal growth factor receptor tyrosine kinase inhibitor. So what is this EGFR, epidermal growth factor receptor? So this receptor is a transmembrane molecule that works through the activation of intracellular tyrosine kinase. It will help in the activation of tyrosine kinase, and this tyrosine kinase will help the cell to undergo unregulated cell growth. It is going in an abnormal way. So tyrosine kinase will allow the cell to undergo an unregulated cell growth. So here we are using the inhibitors of these receptors. This drug will inhibit the epidermal growth factor receptor. Hence, the tyrosine kinase activation will not take place. So it will suppress the proliferation of abnormal cells and also leads to cell death, apoptosis, programmed cell death. The examples are cetuximab, erlotinib, lapatinib, commonly used in colorectal cancer, head and neck cancer, and breast cancer. Next one is BCR-ABL tyrosine kinase inhibitors. So this drug is commonly used in only one condition, commonly used, chronic myeloid leukemia. So here what happens, in this leukemia, an abnormal enzyme is being produced. The name of the enzyme is BCR-ABL tyrosine kinase. And this abnormal enzyme is able to promote the growth of cancer cells. So here we are using the inhibitors of this enzyme. So BCR-ABL tyrosine kinase inhibitors will inhibit the enzyme which leads to abnormal proliferation of CML cells. So examples are imatinib, dasatinib, and AN beta, nilotinib. Okay. Next is angiogenesis inhibitors. From the name itself, you might understand it will inhibit the development of new blood vessels. So angiogenesis inhibitors work by preventing the mechanisms and pathways necessary for vascularization of the tumors. Vascular endothelial growth factor is the most common factor needed for angiogenesis. So for angiogenesis, VEGF, vascular endothelial growth factor, is needed. So here the angiogenesis inhibitor will inhibit the vascular endothelial growth factors. So the drug binds with vascular endothelial growth factor and it will inhibit the angiogenesis. Examples: bevacizumab and pazopanib. It is commonly used in colorectal cancer, renal cancer, and lung cancer. And last one is